Hi, everyone, and welcome to this week's COVID-19 office hours. I want to give just two brief reminders before we go into the tech notes for the week. One is that we anticipate this week will just be about an hour, so we anticipate going until 3:30 Eastern. And then the second is that there will not be office hours next week. So for today, just a couple reminders for us all. We are recording the office hours today. We'll post a copy of that recording along with the slides and the content from the chat to the HUD Exchange. Just give the team a couple of business days and they'll get posted there. Also, if you have any audio issues during the webinar, we encourage you to switch on over to the phone audio. That tends to be a little bit better. And you can do that by dialing into the numbers that are both on your screen and that were just put into the chat right now. All the attendees will remain muted for the duration of the webinar, but we do encourage and hope to hear from many of you throughout by getting messages through the chat feature in WebEx. So if you're not familiar with it, just look all the way over on the right-hand side of your screen. You should see the word chat and then what looks like a message bubble. If you click on that, it'll open up all the chat messages for you. When you are sending us those messages, again, please send all questions and feedback in through chat. Make sure that you are sending them to everyone. It should default to everyone, but if it doesn't, just take a moment and click the down arrow next to 2, and you should be able to select that. With that, I'm going to turn things over to Norm Suchar from HUD's Office of Special Needs Assistance Programs. Norm.
Thank you very much, Natalie, and welcome everyone to today's office hours. So I'm quickly going to introduce everybody, and then we will jump into our content here. So we have several people from the SNAPS office. You'll be hearing from myself and from Sharon Singer and April Mitchell and Caroline Krause on today's webinar, but of several people in the background, and also Letitia, who's not listed here, is going to be sharing some content. So if you have any questions, just put it in the chat window and we will do our best to answer as many questions as we can. We have a couple presentations on some new resources that are out or forthcoming. Alan Marzilli and Nick Mitchell will be presenting those. We will get a regular CDC update from Emily Masitis. We have a very exciting update about the Health Centers program from Barbara DiPietro from the National Healthcare for the Homeless Council. So a lot of great content, and again, if you have questions, please feel free to type them in the chat window and we'll do our best to answer as many of them as we can. With that, I'm going to turn things over to Emily Masitis from the Centers for Disease Control and Prevention to give us our COVID update. Emily?
Thank you so much, and I will just go ahead and dive right into our update for this week. Next slide. So I changed up the graphic this week a little bit because I wanted to draw everyone's attention to the CDC COVID data tracker on the county view. This is a very helpful resource that shows the level of transmission in each county throughout the United States. And what you can see here is that counties are categorized by their level of transmission. I don't have the exact metrics in front of me, but they're on the website, which is linked at the bottom here, that categorizes by high, substantial, medium, and low. So high being red, substantial being orange, medium being yellow, and low being blue. So this, you know, I think more and more as we go forward, it's going to be kind of important to keep in mind what's happening in your local community and potentially in your region. And this is a really great resource to be looking into what data on COVID are in your local area. So that is something to keep in mind. On the whole, nationally, though, just to describe what's going on, we are still on our downward trajectory of cases per day. So that trend still looks good as we head into the next week. Next slide. And our vaccinations are looking pretty good. So 45% of the United States population over age 12 is now fully vaccinated. You can see on this map here that our lower levels of vaccination are certainly in the southeast. So still some work to do there. Things heading upward in a good direction in the northeast. Next slide. I wanted to also draw attention to Morbidity and Mortality Weekly Report that came out last week. Just as a reminder, again, these reports are kind of a great place to get some really updated science on what's happening with COVID. There was a modeling report that came out last week that showed the future of COVID-19 cases based on vaccination and non-pharmaceutical interventions, which is, I'm not sure who came up with that terminology, but maybe the worst terminology for just overall COVID prevention measures that we've all been doing. This is hand washing, it's physical distancing and masks. Those are all considered non-pharmaceutical interventions. So this graphic here is one of the graphs from that report that shows our trajectory in cases per day. So it's actually per week in this graphic. But what you can see is that the cases went up. This is that big spike in January, and then came down. And at the time that they did this modeling, it was at the end of March that they did this. And so they were projecting out, you may remember that we had a bump in cases right around that time. So we started to go back up again before we came back down. So they were modeling out that trajectory, and they modeled it based on vaccination level and also these NPIs, which are all the other prevention measures. And what you can see here is that if vaccination remained low and everybody stopped doing all the other prevention measures, that's where you have this biggest jump in cases around now and around May, essentially. With low vaccination and moderate prevention measures, the bump would be a little bit smaller. With high vaccination, but not great prevention measures, the bump is even smaller. And then high vaccination and moderate prevention measures is really our lowest burden. So essentially what this tells us is that keeping things in place throughout vaccine rollout is certainly the best way forward. That's really where we have the lowest numbers of cases and deaths and hospitalizations from COVID as we move into this space where cases are coming down. I think the most hopeful thing about this graphic is that what you can see is a really precipitous decline through the summer. So it's hopeful in that in all situations, the graph is coming down, the cases per day are coming down as we move into the summer. Next slide. Okay, so with all of that said, that means that it's time to start thinking about what our plans are in terms of prevention measures in homeless shelters. What does that look like going forward as we start to see this shifting in situations? I wish that this slide had content on it, but it doesn't right now. We are, I think, literally possibly right this second, some new guidance is being posted on our landing page. This will be at the end of the shelter management guidance will be an update on things to think about going forward as we come into this new space of declining cases and higher vaccination levels. I will be able to talk about it more on next office hours, but if you have any questions, I'll put our email address into the chat. It should, like I mentioned, it should be being posted right now. So if you take a look at it and you have any questions or are wondering about things, happy to talk about it. And otherwise, we'll give a more thorough update on it next time we talk. And I believe that's it for me. Thanks so much.
Great, thank you so much, Emily. Next, we're going to turn to our next presenter. Barbara DiPietro is from the National Healthcare for the Homeless Council, and she's going to talk a little bit about, or a lot about, partnering with health centers and some of the great opportunities we have here. And I think it's worth definitely thinking about these in the context of the emergency housing voucher program and some of the other resources we have out here, and how these partnerships can help support implementation of some of those resources. So with that, Barbara, take it away.
Thanks so much, and hi, everybody. I'm just going to plunge right into it about some of the funding that's been coming to health centers that I think is a really nice opportunity for some of the partnerships that we've been talking about. Next slide. And you might remember, for those of you who are faithful office hours attendees, I talked about this about a month ago when this money first came out, but just want to remind us that there's a window of opportunity for us in the health center world to be reporting to HRSA how we're going to be spending these funds. So just wanted to come back and get another bite at the apple here and remind you that as part of the American Rescue Plan Act, there was about $6 billion that was awarded, or excuse me, $7.6 billion that was awarded to health centers. Just over $6 billion was announced a little over about 2 months ago for operating costs. And this went to all health centers, and it can be used for a really wide range of activities. Two here are obviously responding to COVID-19, either in building vaccine capacity or in just general response and treatment, beefing up testing, all of that. But if we'll go to the next slide, the funds can also be used for a really wide range of things. So beyond COVID and thinking through how do we want to build our health services capacity? How do we want to participate in maybe stabilizing or recovery work? And then is there any minor infrastructure mobile units that we want to add? All of these eligible activities here are taken directly from the HRSA website. I've highlighted and underlined a few of them that I think make for natural partnerships with HUD-funded programs, particularly around telehealth and maybe seeing how we can't do some really good access to care through embedding services, maybe in shelters or in other spaces so we can extend a health center reach. Thinking about where we might be able to do more vehicles. Broadband is obviously something we've talked a lot about. Recuperative care, otherwise known as medical respite care, a lot of that can be shelter-based and thinking about how you're meeting the more serious healthcare needs of people coming out of the hospital. I just think that there's a lot of potential here. If we go to the next slide. And just wanted to say, I just, again, think that there are some opportunities here for our collective response. I know we talk a lot about how do we integrate health and shelter work or do more with services and supportive housing. How are we really thinking about that continuum of care of services to meet the needs? And I think particularly during COVID, we've seen so much on how we've tightened up our access to healthcare. I think this makes this a nice opportunity to make permanent some of the things that we've been doing temporarily, particularly if it's under new flexibilities or waivers. And so this funding gives us an opportunity to really solidify that. I put some bulleted lists here again that I had mentioned about opportunities that I think make really great sense for us. But the deadline approaches on our end in the health center world. So we only have until the end of this month on Monday, May 31st, to submit our funding plan to HHS. And so if you have a health center partner that you've been working with and are interested in some of these ideas and how you might be able to blend funding, or if you've got ideas about what this might look like, now is the time to really be making that heard. I think, again, great opportunity for healthcare and support services to be combined with some of the partnerships we've got. So just want to highlight that the deadline approaches. So if you haven't reached out to your health center partner, please do. And then the next slide. Because wait, there's even more. So here's new funding that's come out. So I had talked before about the operating funding, but what was just announced a couple of weeks ago is $1 billion in capital funding for us in the health center world. So now we have a new opportunity for doing something really interesting with our building spaces. So if you have any interest in maybe having a health center or some kind of satellite services of healthcare in your shelter or in your housing program and are looking to do more with capital dollars, this is, again, a really great opportunity to do a nice healthcare collaboration with capital funds. They were allowed to use these funds for 4 different types of projects: constructing something new, constructing or expanding an existing facility, doing some alterations or renovations, or maybe just equipment. And so you might see opportunities in here either to perhaps make a space disability accessible, adding some rooms or changing the layout, again, making this more flexible so that we have a better understanding of what the healthcare needs are in our programs. It may be that you want to be changing some of your shelter space to be healthier, more space for people to do activities, and again, maybe adding health services into that. So just wanted to come on and again say that these are great opportunities. These funds really want to see us emerging from this pandemic in a better place than we found it. And so I think these funds give us an opportunity to be really creative. On this capital funding, I'll note that we have until about the end of June, June 24th, to submit details to HRSA. So again, just thinking through what possibilities you might see for your community here. Next slide. And that's it. So happy to take any questions, or if you want to hit me up in the chat, but mostly just excited about getting these kinds of collaborations and partnerships going. Back to you, Norm.
Thank you so much. And I just want to follow up on a couple things because this sounds a little too good to be true. So you talked about, you had a bullet specifically about supportive housing. I know that there are a lot of really great sort of permanent supportive housing and health center partnerships out there where health centers are providing a lot of the supportive services and mental health and healthcare services to residents of supportive housing. So is this really an opportunity to expand on some of those? Because as we'll hear about later, there's this big voucher program that had just announced, and it seems like there are some opportunities. So can you talk about, is that really an opportunity we have here to do, you know, a lot more housing and supportive services for people with really like chronic health and mental health conditions?
I think this is an ideal opportunity for that, and in fact, precisely what we're hoping for. So if we've got all of these vouchers coming out into the system, and so a lot of times there's this mismatch in communities where you might have a lot of services but not enough vouchers, or you might have some vouchers but then you don't have quite the service package put together to really make it work. So this is a great opportunity to think through how many vouchers are you getting, how many of those are going to be used for supportive housing, and then as you're expanding that, think about what are the healthcare needs that need to be met to make your supportive housing program work well. And so I'm even thinking for us in the health center world, beyond the behavioral health piece, which as we know is really critical, but don't underestimate primary care and connections to medical care that can help also manage diabetes, hypertension, cardiovascular disease. It's not uncommon for our patients to be on 10 to 15 medications, and that's a lot to ask case management to handle. And so when you have a nurse case manager or someone else that brings more of that healthcare perspective, I think this is a natural partnership to keep people more stable in their unit and get better health outcomes as well. So precisely what you described, I think, is a good opportunity here.
That's great, thank you. And if people want to sort of, first of all, if people want to take advantage of this, they got to convince their health center to submit a plan by 10 days from now? It could be quick turnaround if you haven't already been talking about this, but not impossible. We have all demonstrated what's possible to do in 10 days. So let's keep that good juice going. And so assuming that people are successful and health centers request funding for these purposes, where can people find more information about how do you structure this kind of partnership? What are the activities? How do you sort of operationalize some of this? Sure. So if you want to look at the details for what HRSA has laid out, I had the links in my slides, and so I can always put that in the chat box. That's easy. In talking with your health center partner, they'll know more of the ins and outs of how to work with HHS funding, just like the HUD funding is a mystery to us as well. So we're each experts on our own respective funding streams. So when we sit down at the table together, we bring that collective knowledge. So definitely reaching out to your health center folks. They'll be able to answer a lot of those questions. Fantastic. Well, thank you so much. This is very, very exciting. It does feel like a lot of different pieces are falling into place to do really big things on homelessness, and it's just very exciting to be in the middle of this. So if you have any questions for Barbara, please feel free to type it in the chat window. And we're going to move on to our next presentation here. Very happy to introduce Alan Marzilli. He's going to talk about some tools for landlords and tenants impacted by COVID. So Alan, I'm just going to turn things straight over to you.
All right, well, great. Thank you very much. Just to sort of put this into context, because this is a product that is aimed for landlords, and it's intended to be used in as part of that landlord outreach, when they say, well, what am I supposed to do? How am I supposed to do this? I don't know how to do these things. We do have some of the resources up on the HUD Exchange that are meant to be either handed directly to landlords, or because, you know, they're in forms where you can pull them apart and put them on your own agency, brand them as your own, and personalize them more toward your local audience. And so we're really at a critical juncture as far as getting landlords to help, you know, to participate in some of the activities that are going on, some of the funding that's available to prevent evictions, because we are at a really critical juncture here with, I've read anywhere between 1 in 7 to 1 in 5 renters in the country nationwide is behind on their rent. And that I've seen an estimate that tenants collectively owe landlords about $53 billion. And so it's a very challenging time for landlords. And when you're interacting with landlords, it's important to understand some of the financial pressures that they are facing and trying to give them a way to help them retain some of their tenants. Could we have the next slide, please? So what's in this document? We have some strategies that landlords can use for engaging tenants who are behind on their rent, examples of questions that you can ask and you can't ask. And again, that's going to be something that you'll know in your in your community. There may be questions that they're not allowed to ask about source of income. So you can't say, well, have you, applied for this thing, this benefit program? Whereas in other places, that's the question that you should be asking, like, what have you been doing to figure out a alternative to this situation where you're behind on your rent? It gives landlords some ideas of what they can ask for. It also talks about some of the elements that should go into a repayment plan, including some links to sample agreements that can be helpful. Again, it's all going to be based on local law, so there's not any national landlord-tenant agreement, but you find that looking around, when we prepared this document, we found a number that were prepared by some of the local realtor associations as resources for their landlords who, make up a big chunk of their business and are important constituents. And so, the question is, well, why would landlords be interested in doing this? The moratorium is ending. Well, actually, a key point to remember is that when you talk about moratoriums, there's actually at least 2 and maybe 3 that you have to think about. There's the CDC moratorium, which has been challenged in court. There's been some litigation over the last couple weeks, and so that's somewhat uncertain. That was the sort of the catch-all moratorium. And then there's also the HUD moratorium, which probably everybody realizes is currently scheduled to end on June 30th. And Norm, please jump in if I have that date wrong, but I think it's June 30th. And so they might be very interested in figuring out, what am I going to do to, how can I take advantage of this? And it might seem counterintuitive for them to try to retain tenants who have fallen behind. But it's important to remember that there's relief coming to states. States are putting dollars into that. That eviction is costly whenever it happens. They have to go through the whole court system, and then they have to even just turnover on a regular basis is costly. And then they'll be looking for new tenants. And a lot of the other tenants are a lot of the people who are going to be looking to move into the unit are in roughly the same boat as the tenants that they are getting out. The pandemic has taken a huge toll on a big cross section of the population. And so sometimes, they would be better off sticking with a tenant who they know and trying to come to some sort of agreement with them versus trying to find somebody that they don't know. Could you do the next slide, please? And so what you'll find in this document, the heart of this document is what would go into a repayment plan. And just, some of the obvious things like how much they're going to repay, when they're going to repay, what happens if they don't do it, under what conditions would the landlord proceed to eviction, or how else would the agreement be voided, for example, if they're violating other terms of their lease, or they sublease it, or they, who knows. I think that with some of the new programs coming along, you might want to look at this and, and sort of add in the fact that with, depending on how your state is handling some of the more recent funds that are designed to go directly to landlords, that would be also something that you could sort of bundle with this document. Next slide. That's sort of that's basically all I have. I think it's a good document to use as a tool when you're speaking with landlords. And if you have any questions, my email's up there. And Norm, back to you. Do you have any questions about this?
Great, thank you. No questions, but thank you so much. And I think this is such an incredible resource given where we are in the pandemic. And like you're saying, the end of some of the eviction moratoria and also the ramp up of the emergency rental assistance programs really gives us an opportunity to prevent a lot of evictions, to help a lot of landlords and tenants who are just struggling mightily through all of this. So thank you so much for presenting on that. And again, we have links to the resource in the chat window. And if you have any questions for Ellen, please go ahead and type them in the chat. So next, we're going to turn to our next presentation. I'm very happy to introduce a couple snappers, April Mitchell and Caroline Krause. They're going to answer some of the common questions people have had about the emergency housing voucher program. So April, I'm going to turn things over to you.
Thanks, Norm. It has been great to listen to all the prior presentations about different funding opportunities and how we can blend these things together going forward. So today we're going to give just a little bit of an overview, very quick overview of the vouchers, and then go into some questions. Next slide. You could probably go next slide as well. All right, so what are the emergency housing vouchers, EHVs as what we've been calling them? It's 70,000 worth of vouchers awarded to about 700 PHAs across the country. The PHAs must accept referrals from the coordinated entry and other partners instead of issuing vouchers on their current waiting list. Many of you guys have heard lots of our webinars over the last week. Thank you for participating and being involved. So if you listen to those webinars and read the notice, you understand that PHAs and COCs in this process are strongly encouraged to partner to match services and clients with those vouchers. Next slide, please. So you guys heard from us the last 2 weeks. Eligible populations for the vouchers are homeless, at risk of homelessness, fleeing or attempting to flee domestic violence, dating violence, sexual assault, stalking, or human trafficking, and recently homeless as determined by the Secretary, and for whom rental assistance will prevent the family's homelessness or having risk of housing instability. It's important to note that PHAs and TOCs do not have to serve all 4 populations. The MOU, as described in prior conversations, will describe the context and all the specifics of who the voucher will serve. And feel free. We've got lots of information about the MOUs. The FAQs point to that. If you have questions, you can place them in the chat and we can answer them later on. Next slide, please. So some key dates that have happened. On May the 5th, the Emergency Housing Voucher Operations Notice was published. On May the 10th, the EVH allocations were announced. May the 24th is a very important date where PHAs must inform HUD on the number of which vouchers they're going to accept. By July the 1st, the annual contribution contract will be effective. That'll be the effective date. And then by no later than July the 31st, the COCs and the PHAs must enter into an MOU together. One note that we always like to put out there, it's okay to go ahead and get started on those MOUs to be able to make that deadline. So always the sooner the better. Next slide. Some further information, you can go to the EVH at HUD.gov site. They are posting information daily, FAQs, the listing of the webinars are there, loads of information, contact information for the PHAs and the COCs are also there. And then you can also view the notice and the invites that went to the PHAs. Next slide. So Caroline's going to kick us off. We're going to go back and forth over some common questions. Caroline, want to take the first one?
Hey, thanks, April. Sure. So one of the questions we've gotten from a number of different sources are, did the vouchers go away after a certain time period? They do. There are kind of two answers to this question, but I also want to frame kind of an overall way of thinking about these. So the first thing is that vouchers, the funding for vouchers in the American Rescue Plan did say that the funding was only insured through 2030. And after that, they don't say what happens to the vouchers. In terms of that, and so I've heard some people ask, are these not permanent? Is it risky to use these for moving on because it would put a client at risk? And I just want to really share that 9 years is a really long time. And I would encourage everyone to think of these as permanent vouchers because a lot can happen in that time period. And we can make sure that, there are a number of different things that housing authorities, Congress, HUD can do to make sure that no one is ending their assistance at that point. So I would encourage people to think of these as permanent vouchers. The other thing to mention, the date to mention, is that the PHAs cannot turn over vouchers after September 30th, 2023. So that means that a family that has a voucher at that point can stay on that voucher and can continue to use that voucher for housing assistance. But if that family leaves, that voucher cannot be reissued to a new family. Next slide, please.
Great. So the next question we've gotten lots of input on or feedback from. The central MOU identified in the operations notice identified the COC executive director as the signatory, but our COC does not have an ED. Can the COC governance board chair sign the MOU, or should we use the collaborative applicant? So this is a very good question, and I know we've in our programs really enjoy getting into the details of who should be signing and things like that. So it's important to know that HUD is not requiring a specific entity from the COC to sign the MOU for the EHVs. The signatory should be whichever entity that makes sense for the COC and has the authority to sign for the COC on behalf of the COC. Generally, the MOU should be signed by the legal entity to make it enforceable, and that in most cases is the collaborative applicant. So like we said earlier, identify who that person is or those folks who need to be on the MOU. The sooner the collaboration between all your stakeholders happen, the better. Next slide.
This is a question that's come up a lot. So can ESG or COC funding be used to marry supportive services or case management with the EHV? So as a number of people know, the emergency housing vouchers do come with a $3,500 per voucher award to the PHA. Now, it's not directly connected to the voucher, but a PHA is going to be getting an amount equal to $3,500 per voucher awarded to help with supportive services, which can be lease ups or rental, search assistance, landlord incentives, some incentives for the clients, but particularly it's important to mention that case management is not one of the eligible, ongoing case management is not one of the eligible uses of that services fund. So we've gotten a lot of questions of what sources you could look at for the services. So I think Barbara had a really great suggestion of looking at medical centers that may be able to tap into some of that funding. But you can use ESG, including ESG-CV, or COC funding to marry or to braid together funding with EHVs as long as the clients are eligible for each program. So as April mentioned earlier, the eligibility criteria for EHVs is generally broader than it would be for either the ESG or the COC program. So you do need to make sure that the client would be eligible for the ESG and COC program. But if they are, you can definitely bring those services together. I did want to mention that we are creating a number of different technical assistance products to give more examples and ideas for how you could marry those together and some of the more detailed rules of how you would use those funding sources together. So be on the lookout for that. Next slide, and I'll pass it back to April.
Great. So can you clarify if or how agencies partnering with PHAs are paid? One other follow-up that we'll get from that type of question is, if the COC or domestic violence agency refers a family or assists a family, does the PHA pay them by way of services or fees or out of the normal admin fee? And if so, at what rate? Or are the partnering agencies paid some other way? So those are the types of questions we get here. And in general, the PHA may enter into an agreement through the MOU that is required to reimburse the COC or other partner agencies. Now you can see the notice, section 6 of the notice that'll define the administrative fees and other funding for eligible expenses. So for example, housing search assistance is required to be made available to EHV families during the initial housing search. Housing search assistance may be provided directly to the PHA or through the COC or other agency or entity. Where housing search assistance is being provided by the COC or other agencies, the PHA may reimburse the entity for eligible activities as defined in the partnership agreement. So as a reminder, COC funds can be used to cover many of the costs associated with the EHV program. So for example, coordinated entry grants can be used to cover the coordinated entry costs. Rapid rehousing funds could be used to assist with housing location and et cetera. In addition, the ESG-CV funds may be used for referrals, housing location, et cetera. Other things such as outreach, essential services, and emergency shelter can also be some eligible sources. We'll go to the next slide. And lastly, one question we've received, will PHAs be required to use the HMIS for purposes of tracking the EHVs? So the question is, or the answer is, PHAs are not required to use HMIS, and that the PHAs will be required to use the VMS and the PIC ENG system. So that's just a very short and brief answer. We'll have some more information coming out with, in some FAQs later. For now, that's our presentation for the day. Caroline, I don't know if there's any other questions you think we should answer from the chat. Norm, it's up to you. Thank you all.
Thanks. There are a couple questions that I think you guys are probably going to be able to answer. So one is, if a PHA does not accept all of their vouchers, then where do they go? Do they go to PHAs that did not get any allocation of vouchers, or do they go to other PHAs that it just pluses up existing voucher allocations? And do they just sort of go nationwide, or are they sort of are they kept nearby?
So this is a very important. Go ahead. I'll take one piece, Caroline. Okay. You take the other. So okay, this is a very important conversation to be having within your community. You might want to talk about addressing capacity issues. You want to talk about what's feasible, what stakeholders you have, look at your services and things like that. This is definitely an area of importance to where folks are determining over the weekend, whether you're going to accept or decline. So it's very, it's something that we're hoping folks are highly considering and being in constant contact about. So Caroline, you want to talk about the distribution going to a state housing authority versus being distributed across the rest of the state and the PHAs?
Sure. As April said, so it really depends on if there's a state PHA. If there is a state PHA, any declined vouchers are awarded to that state PHA, which is in addition to any vouchers they may have initially been applied for or been invited to apply for. In terms of states that do not have a state PHA, then the number of vouchers are prorated across all PHAs that accepted their EHVs.
So in that case, PHA that did not get an allocation, they're not going to get an allocation through this sort of recycling process. It's generally going to go to a state PHA or the other PHAs in the state that already had allocations. Great. And then the other question, and I think this is just sort of a clarification of a point, is so somebody was asking, they weren't aware that PHAs could subgrant to other organizations. April, you mentioned that they can put in the MOU to get reimbursed, or that partners, other service partners, can get reimbursed. They're going to contract for that, right? That's not like, I know the differences are subtle, but it's not like subgranting or anything like that. They're probably just going to directly contract with organizations to do that. Is that right?
Yeah, that's correct. I mean, that's a very interesting question. I don't think we've seen the sub-grant side of things come up in terms of this conversation, but you're exactly right, Norm, that when they are working on their MOU and who's going to provide services and who's going to be reimbursed, it appears that it's going to be more of like a direct payment structure to that organization versus like a sub-grant within.
Great. And the last topic, and I know we covered this last week, but I think this is really important, is about, it's like, do you have to serve all of the eligible populations? And what exactly does that mean? So Caroline, I think you went through this last time, but can you talk about, does the PHA have to serve all the eligible populations, and like what are the requirements there?
Sure. So that's a really good question, and it's kind of a complicated question. So what we're asking for communities to do is to bring together the PHA, COC, and any stakeholders to really identify who is in the most need in the community, and also what services could best be matched to the vouchers, to identify who should be referred over for the vouchers. And using the coordinated entry system, you would then implement that prioritization to send over the referral to the PHA. The PHA is required to accept those referrals, and at that point, they cannot say, well, we're not going to serve this one population. But so it's a difference of the PHA is required to serve all the populations, but there is a prioritization factor in this, which is why the vouchers are put through the coordinated entry system. And that's a community-wide conversation that we really encourage everyone to just get into as soon as possible to identify the best ways to serve the people, the community of people experiencing homelessness in the community.
So if ultimately a community finds that they have so much need in one of the categories, and through the prioritization process, essentially all the people who get sent over to referred to the PHA are from just one of the categories, that's fine, assuming that's where the need is. Yep.
Yes.
Great. So I know people have a lot more questions, so please feel free to keep typing in the chat. I know Caroline and April are already looking at your chat questions and trying to figure out how to answer them. We're going to move on in our agenda. We're next going to talk about, get an update on our grants, ESG-CV grants, and how we're doing on allocating and drawing down funds. So I'm going to turn things over to Sharon Singer from the SNAP's office, and she's going to talk us through this. Sharon?
Hi all. I think today's going to be extra quick. We don't have too much going on, but things are continuing to tick up. As you can see, almost all of the awarded funds are in IDIS. We are almost 70% committed, and funds are being drawn. We're about 8%. And as I've said in past weeks, I know that folks are using their, doing the activities on the ground, expending funds, but we need to be able to see that you are drawing the funds to reimburse yourselves for all the good work that's happening. So like I said, we're getting close to our September 30th deadline. We have 54 out of 362 grant recipients who are already at the 20%, but we're hoping that everybody is there very soon. That's about all I got today, Norm.
Great, thank you so much. One thing I want to mention is as September 30th draws closer and closer, more of you may be interested in sort of talking through different ideas about how to make sure you meet your draw requirements and your expenditure requirements. We are very happy to provide any technical assistance we can to help walk you through that. So please reach out if you need any help, and we're, again, happy to provide some assistance. So we're going to move on to our next topic today. We have another product. This one's forthcoming that we want to talk to you about. So I'm happy to introduce Nick Mitchell, and he's going to walk us through this great new tool that we're going to be publishing soon. So Nick, over to you.
Thank you, Norm, and hello, everyone. It's wonderful to be with you today. I want to start by acknowledging that I'm following a presentation on vouchers and using the term voucher a lot, but in a very different context. So when you think of voucher as PHA rental subsidy, like April and Caroline were discussing, we'll set that to the past presentation, and I'm going to use the word voucher in the context of requesting and dispersing ESG grant funds between recipients and subrecipients. So just wanted to add that note of clarification since we're using the same term. So I'll be introducing and demonstrating a set of forthcoming grant management tools, and they're aimed at clarifying that reimbursement and vouchering process for ESG-CV specifically. So I want to first recognize Nora Lally and Megan Takashima for their work in conceptualizing this and helping make this tool come together, as well as a lot of helpful feedback from folks in the SNAP's office and elsewhere. So I'll be sharing in a moment two tools that are set up to work together. One is designated for subrecipient use and the other for recipient use. Together, they seek to incorporate kind of the entire continuum of the vouchering process, all the way from an individual subrecipient expense through the actual voucher request up to a recipient's overall expense tracking. So we know that the vouchering process can look very different from community to community. So some of you may find that your current infrastructure already covers all of the benefits offered by these tools, and some of you may want to incorporate only certain components of this set of tools. And then there may be others who find it beneficial to make a more comprehensive use of what we have to share. So I just wanted to recognize that diversity in process at the beginning so folks can kind of look at these from the vantage of their own system and take or leave what suits you best. So I'm going to share my screen here and start with the subrecipient tool. So you all should see a Excel workbook with a side A and a side B on it, and I will be walking through this. So the subrecipient tool has 5 tabs overall, but the 2 through 5 are identical. The first tab is an expense register tab for inputting and summarizing expenses for the current period. The subsequent tabs are all voucher request tabs for each period. Each tab begins with detailed instructions that you can, those rows are grouped, so you can open those rows and minimize them, but I will leave them minimized for the presentation since I will be talking you all through it. So this first tab is an expense register and summary. So you can kind of think of this tab as the staging area for each period's voucher request. So this is where your detailed expense information gets input, and then it will generate an expense summary that you can then transfer into the voucher request for the current period once you've entered all your expenses here. So as you can see on side A, there are 8 columns with the green headers, And the first 4 columns allow subrecipients to input general information tied to a particular expense like date, check number, payee, description, and those can be customized for local needs. The following 3 columns, though, are set up with drop-down menus that the subrecipient can use to classify costs according to first the ESG component, then the cost category, which is matched up with the activity category under that particular component, and also the SAGE reporting category for the ESG-CV quarterly reports. And then in the subcategory column, subrecipients can tag the actual allowable cost that they're reporting this particular expense under. And then the last column, you can input the actual amount. Above those final 2 columns, there's a totaling cell that will total automatically everything that's input into this table. And as you input expenses on side A here, and tag them by component and category and subcategory, side B, the expense register summary, will automatically total those expenses and summarize them by those categories. So if you look at this table on side B, it's organized by ESG component in the red header, and so you see homelessness prevention, rapid rehousing, and on down through the list of components. And then it's broken down by the activity category in the dark blue, and then each allowable cost underneath the activity category is listed in the white cells. So if we look down at our rapid rehousing section for this example form, you can see that the inputs from side A have all been summarized on side B in this expense summary table according to how the subrecipient tags them when they input them into that first table. So recipients can then use this summary table to transfer expense information by component into the voucher request tab for the relevant period. So I will now jump to a voucher request tab, the next tab for Q1. So side A is the voucher request itself, and side B is a voucher request summary that's structured in a way that allows data to be easily transferred into the recipient tracking tool, which I will share next. So side B requires no action from the subrecipient other than making sure that the summary totals are accurate after they've been completed in side A. So as you can see on side A, the reimbursement request is laid out in the same way as the expense register summary from the first tab, which allows for the easy transfer of expense data. There's only 2 inputting actions that a subrecipient must take on this tab. In the first column, the subrecipient can add their budget by component and category consistent with their subrecipient agreement. This only has to be input for the first period. The budget information will carry forward to all subsequent periods in the following tabs. The second input, and the only input for all the subsequent periods, is just to transfer the expense summary information from tab 1 into the corresponding cells in the this request column that you see here with all the cells highlighted in yellow. So I'm going to do that now with our example. You can go back to the expense register, our staging area for each period, and you can just highlight, you find your component, rapid rehousing, highlight those cells, and then copy them. Then jump to the current period's voucher request, find your component, rapid rehousing. I've got some budget information plugged into the first column, and then just paste the values into that first cell, and your expense information shows up from that summary. And 3 new sets of data appear when you do this. First, you'll have in the third column a cumulative total that you've expended, and that information also carries forward into all subsequent vouchering tabs. And you have a remaining total after this and your cumulative expenses have occurred. The third piece of information that populates is you'll have on the summary side, under the particular component you're working with, that information summarized just at that higher level of activity and SAGE category. And so this is where the recipient will draw that information when you've made a submission to them. So that is all the action required from the subrecipient in this tool. And just want to make one note in terms of record keeping. A subrecipient can save a version of the current period once it's final, once all expenses are input, and then once it's saved for that period, wipe tab 1 and save a version for the next period, and that'll allow you to reuse that staging area on tab 1, always for the current period, while then carrying forward the summary data in the vouchering tab. And then your detailed expense records for each period will be archived in those versions that you saved before wiping. So now I'm going to switch over to the companion tool for recipients. But before I do that, I'll just note again that the recipients are able to pull information from this summary, and it's laid out in the same way on the recipient tool. So I'm going to go ahead and do that for this rapid rehousing submission. So I've got that information copied when I go to the recipient tool. So what you see now is the companion tool for recipients, and this is designed to maintain a record of all disbursements made to subrecipients for ESG-CV, and excuse me. And also the tool allows the recipient to track expenses by quarter for ease of reporting, and also has a budget dashboard on the second tab to show expenditure progress at a summary level. So tab 1 of the recipient tool, this disbursement ledger, consists of a table where recipients can input and retain information about disbursements made to subrecipients, and it's set up to allow recipients to enter information about an individual disbursement to one subrecipient as one row, as you see in our example here with the submission we were just working with on the subrecipient tool. So the columns allow information to be input about each disbursement, like organization name, project name, contract number, and then you can select a quarter from the drop-down, a request date, and a disbursement status. All of the subsequent columns are organized by ESG component at the top, and then activity category, which is also, as I mentioned, matched to the SAGE expense category. And these are laid out in the same way as in that reimbursement request summary that we just pulled information from the subrecipient tool. So I have my information copied from there already, so I can find my rapid rehousing component for the Housers Are Us Rehousing for Health program, and I can go ahead and paste those values into these cells that are set up exactly the same way. So every time you add another disbursement into the table, it's going to calculate for you quarterly totals at the bottom of the spreadsheet. So our Q1 total we now have in our rapid rehousing expense table. We see all that information that we just put in for this particular disbursement. And then lastly, there is a budget dashboard on the final tab, and there's only one input required of a recipient on this tab. This allows the recipient to track the overall expenditure progress on their entire ESG-CV grant, and the recipient can plug information into that first column, the grant budget, and that can either be done by activity category or just for the component overall, depending on what level you're tracking at. And then there's no further inputs required. The dashboard's set up to pull expense information from the first tab, from the disbursement ledger. So here you can see the progress we've made just based on that one disbursement that we input from the Rehousing for Health program. And so this shows for the rapid rehousing your expenditure progress on these activity categories for the component overall. And then at the top, there are totals for the grant that show your budget, the total expended percent, and the remaining amount. So that covers the full scope of these tools in terms of an overview, and I will go ahead and hand it back off to Norm. Thank you all so much.
Thank you so much, Nick. Great tool, especially if you're, the person who has to track all these finances. So thank you so much for that. And again, that will be published soon on the HUD Exchange website. We're coming near the end of our time. I do want to address a couple questions. There was a question earlier about upcoming NOFAs. I did want to just give a minor update. So we are actually very close to publishing the YHDP NOFA. As a reminder, this covers 2 years worth of YHDP funding. So I'd encourage people to be very on the lookout for that, maybe next week, maybe the week after. But so please be on the lookout for that. And we're very excited to have 2 new rounds of awardees for that. So again, be on the lookout for that. We also, I think there was a question, and Marlisa, I wonder if you could sort of repeat the answer to this question, but there was a question about using the flexibilities from the ESG-CV notice for 2021 regular ESG allocations, and whether we would be doing anything to allow that. Can you talk about what's already allowed with respect to using the flexibilities in the ESG CARES Act notice?
Yes, so the ESG-CV notice already does provide flexibility for the fiscal year 2021 ESG funds that are used for COVID response to exercise those flexibilities for those funds. And Shay just cited the notice helpfully and correctly identified that we cited 2020 and 2019 funds as examples. So including 2019, 2020 funds, but not including but not limited to the flexibilities applying to those funds.
Thank you so much, Marlisa. That's great news also. So we're at the end of our time. Thank you everyone for all the questions. The ones we weren't able to answer, we will try to get to those in the future office hours. I want to remind everyone, we will not have an office hours next week. So we'll be back in the first week in June. And I want to thank all our presenters today. Thank you for showing us those great tools and resources. Definitely want to thank Emily and Barbara. Barbara, great presentation on a great new resource that we're super excited to be able to utilize. And thank you, April and Caroline, for walking us through some of the common questions people have about the EHV program. Again, just a really once-in-a-lifetime opportunity to house a lot of people, and it's all very, very exciting. I want to thank Letitia for putting together all the content and organizing all the content here, and thank the other snappers who have been answering questions. And once again, thank everyone for your incredible work and all the progress you've made on keeping people safe, housing people in this unbelievably challenging time. With that, I want to wish everyone a great rest of the day, a great weekend, and that concludes the webinar.